Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. Hey, everybody. Crystal Stokes here with Dr. Phil Richmond, who is the Chief Medical and Wellbeing Officer for Veterinary United and the founder and CEO of Flourishing Phoenix Veterinary Consultants. He is a veterinary workplace wellbeing and resilience expert and advocate, and is involved in multiple state, national, and international efforts to improve workplace wellbeing and prevent suicide in veterinary medicine. And today, we are talking about a very interesting topic, something that's also sometimes considered a bit taboo, which is trauma in veterinary medicine. So, Dr. Phil,
yeah,
it's funny to call you that, Phil. Why don't we start off today, if you don't mind, with a bit of your story, because I think it informs so much of the work you do today and why it's so important to you.
Yeah, thanks. And thanks for having me, Crystal. And thanks for having this podcast, by the way, because you just have the most interesting people. And we were just talking about one of them, our friend Josh Weisman, who just shout out. He's an amazing human being and just a lot of great people in the industry. So thanks for the opportunity.
Oh, absolutely. And you're one of them.
Oh, thank you. So thinking about it, I go back to, when I was in vet school and, I graduate, I'm out about a year and a half and I'm just overwhelmed. The things we hear about in vet med, the perfectionism, the anxiety, the imposter syndrome, all of these things, were just pretty overwhelming for me. And I just didn't see a way out. And so I do want to say, a warning here is that I'm going to talk about suicidal ideation and depression. So again, about a year and a half out, and I'm working about 70, 80 hours a week, self-imposed. I thought that's what I was supposed to do, which, by the way, we're going to talk a little bit about trauma. Found out I was on a podcast with a trauma expert from who works with PTSD and the military and folks like that. And she said, by the way, just so you know, that's a trauma response too. The overworking and all of that. So I was like, oh, there's a new one that I add it to the parts of the story. But anyhow, so I'm working 70, 80 hours a week, and it's self-imposed. Like I'm working on my days off at another animal hospital. I'm picking up emergency shifts. The practice that I worked at, and I want to make this clear because it's the practice that I worked at did not do that to me. Like they did not overwork me. I did that. That was self-imposed. But I was just coming home every night. I'm working 12, 14-hour days, and I'm just like, I can't do this for 30 years. Like, I don't even know if I can do this for another week, and I had one tool in the toolbox that I'd had since I was, in high school, and that was alcohol and substances. Mm-hmm. And I had neatly evaded, the consequence. Well, not the consequences, but just that I had thought, well, I can't have a problem because I'm doing well in school, or I can't have a problem because I'm performing at this level, and all the rationalizations and minimizations that I went through. And it just got to the point where I was drinking every night. I just, I couldn't see a way out, and I had a Ruger 9mm that I had out. I had pulled it out of my drawer next to my bed, and I had it on my bed table. And I remember I'd be at work, and I'm like, if A, B, or C happens, I'm going to go home and I'm going to end my life. And I didn't know, I didn't see a way out. And thank God my still at home, obviously, the pooches, but so I'm just at this point of despair, and I didn't want to live. I didn't necessarily want to die. I just was apathetic. And thank God the people that I worked with recognized what was going on with me. And because I was really affected at work. And so they got me into a program for medical professionals in the state of Florida. And most states have these, by the way. It's a professional health or a physician's health program. They call them PHPs, but most states have these. So if you're a medical professional and you have an alcohol, substance use disorder, anger, any type of mental illness, there's something that will protect your license while you're able to get treatment, and get better. And so thank God they did that, because it saved my life. And so I was in treatment, and I'm a kid, I'm a year and a half out of school. I'm just a kid in veterinary medicine. I feel like, and I'm full of shame. I'm full of guilt. How could I let this happen? What are people going to think of me? How could I not stop on my own and end up finding out that, there was a way out? And I found out a lot of things, and got into recovery, got a lot of tools to help me enjoy veterinary medicine again. Tools like you're very familiar with cognitive behavioral coaching. Well, we'll call it coaching if we're not a therapist, but those types of things, and things that I learned in 12-step recovery. And I was like, oh my gosh, like these are the reasons why. Like now I'm seeing how my thinker, was getting me down a road that I didn't need to go down. I was experiencing all these like bone crushing negative emotions, or, not negative pop, but just, I was feeling emotions that I didn't need to feel. And it was just, I was able to be more self-aware. I was able to challenge my thoughts and take them to court. And so it was just amazing. And it's still challenging, of course, but those things helped me love veterinary medicine again. So the interesting thing is, and what we're talking about today is then, when you're in recovery, you hear about, well, I mean, my dad was an alcoholic. He most likely had bipolar disorder as well. My sister's a therapist, actually, and she was like, by the way, our dad definitely, definitely had that. And so he was, and there was there was domestic violence in the home. There was some physical violence towards me. And I mean, and this, my dad did the best that he could with what he had. He had gone through similar things as well. So anyway, what I'm getting at, I think you know where I'm going, is that I didn't know that those things, when they were going on when I was a kid, that those stressors that happen, they change the way that our brain forms. It's amazing when you see the dendritic connections, when you see all of this happen from the stress hormones, from cortisol, epinephrine, all these things, what happens to us as kids. And so come to find out, like 4 years ago, I come across the ACEs study, which is the Adverse Childhood Experiences. And it's a 10-question assessment. And so the questions, and I invite everyone to, I mean, this is part of what we're talking about. I invite everybody to go look this up. The ACEs study from the
I can link
CDC.
it in the show notes too.
Oh, yeah, absolutely. And then being able to take the ACEs assessment, the 10-question assessment. And so it has questions like that. Like, were you ever physically abused? Under the age of 18, were you ever physically abused? Were you sexually abused? Were you verbally abused? Did you see violence in the home? Did you have a parent that had a mental illness? Did you have a parent that had an alcohol or substance use disorder? Were your parents separated or divorced? These types of things that I thought were normal. Like, I didn't know any difference. And then come to find out, if you answer yes to 4 or more of those questions, you are 7 to 10 times more likely to have an alcohol or substance use disorder. You're 6 times more likely to have ADHD. If you have 6 or more, I have 6. We die 20 years earlier than the average. Suicide attempts are 37.5 times higher than the general population, or than someone who has 0, I should say. PTSD, you're 4.5 times more likely. Depression, you're 5 times more likely. All of these things that, as a veterinarian, I'm like, if there was something that our patients went through that increased their risk factors of these diseases, of any disease we would be all over it. It would be like, we'd be screaming from the rooftop. Like, no, every vet student would know. And that would be it. Like, you would just know, and you would know that these are things that you need to be aware of. But I did, and we generally speaking, don't in veterinary medicine.
Now, I would assume that most people listening to this have never heard of ACE at all. It's not common knowledge. And even the word trauma, I think when a lot of people think of trauma, they're either thinking of physical trauma, like getting hit by a car, or they're thinking of what we in therapy call capital T trauma, which are giant events like somebody died in front of you or you were assaulted. We don't think of the little micro traumas that build up over time, or the childhood experiences or the patterns.
Yeah. And so I'll say this too, is what's fascinating to me is, we think about, and then when we think about it in the workplace, we do encounter those things. I mean, that's, I'm grateful to be a suicide prevention gatekeeper instructor for QPR, and just doing all the studying through that. And when we talk about compassion fatigue and secondary traumatic stress, those things are real that we experience at work. But what's fascinating to me is it's the stuff that happened before we even went to school, before we even started as veterinarians, before we even got down that path. Yeah, go ahead.
Let's pin that a little bit, because I think it can. The first time we hear this, I think it can sound almost a little bit woo or strange, or is that fact? But what you're highlighting is that what studies show is that the development of a child's brain is different in different environments. So if you have a child who grows up with relatively low adverse experiences, I mean, we all experience negative stuff. It's going to happen. Yeah. But relatively low, fewer than 4 on that ACE assessment, their brain will develop in a different way than a person who experiences 5, 6, 7, 8, 9, 10 of those. And so when you take a brain of a child that has experienced a high level of adverse childhood events, it primes them to have reactions to things later in life that we might respond differently than somebody who had less adverse experiences. We might be more impulsive. We might have fewer coping strategies. We might have less emotional regulation skills, all the sorts of things that we don't have to go too far in depth on the nerdy side of it, but just to know that that's what we're trying to frame today, is that as an adult veterinarian, some of the stuff that you've been through as a youngster, maybe informing some challenges you could be facing today. That's what you're trying to highlight, is that by being trauma aware can help us work with our staff.
Absolutely. Absolutely. And so what's really neat about this is that, so I told you I was talking to, you may have heard of her. Her name's Dr. Shauna Springer. Anyhow, she's a trauma therapist, working with veterans and such. Yeah. But she was saying too, is that she's like, I work with veterinary professionals as well. She mostly, the professionals that she works with are usually veterinary technicians. Yeah. And so this is where I find it fascinating, is that Dr. Elizabeth Strand, who's just, amazing advocate and created the veterinary social work program, and just God bless her. Like, she's just an amazing human being. And Jen Brandt, from the AVMA, Dr. Brandt, same. And they, in a group of mental health professionals working in vet med, actually did do a study, and their hypothesis was, and this is if I'm paraphrasing and I don't have the study in front of me, so bear with me if there's a little wobble here. But if I remember correctly, when I was talking to Dr. Brandt and Dr. Strand, is that their hypothesis is that veterinary students potentially had a higher level, higher number of ACEs than the general population. And we went because, and these were things that I latched onto now in hindsight, having been through the experiences that I did, that that we became caregivers early for animals, as a trauma response. Mm-hmm. What was fascinating to me is what they found is that the cohort of veterinary students that they surveyed had the same, about the same distribution of ACEs as the general population, which the general population is about, if I remember correctly, I think it's 12.5%. Huge number, by the way. So over, like 1 in 6, 1 in 7 of us have 4 or more ACEs. So somebody in your hospital, mm-hmm. your clients have all gone through this. But anyhow, not your client, I mean, just like whoever's listening.
In general, right?
But yeah, in general. So what I put together, what I thought was fascinating is I was like, well, what's interesting to me is knowing from resilience and I am not a mental health professional. I'm just an avid, certification junkie. I joke with my wife, who's been with me since, before I got sober. I was like, now I take certifications like I used to drink. Like I just can't get enough of, the knowledge around applied positive psychology and stuff. Anyhow. Mm-hmm. So we know, though, that protective factors, that there are things that can ameliorate or buffer, us when it comes to suicidal ideation, when it comes to some of these negative emotions and these things with trauma. And I was like, it's interesting because to get into vet school, I was like, you have to have some of those things as part of the process. Like you have to have a mentor. Mm-hmm. That's or most likely you have to have a mentor that's not a parent, non-parent role model. You have to have some other buffers. And through through what we do to get into vet school, I was like, you know what, damn it. I'm like, I bet that has something to do with it. And literally, I think it was maybe if I'm right, hold on. I have this study. So I didn't, I thought it was a few months. It was a year ago. A year ago, they did the same. They did this in medical students.
Yeah.
And so I just laugh because I tell actually Josh, I'm like, I don't know that I've ever had an original idea, but I'm excited sometimes that I think like smart people do. So a year ago, they did this study on medical students, and that's what they found is that they did see a little bit higher ACEs in those students, but that there were protective factors that helped them. But what they didn't ask in the survey, and this is where I think now we can build on, I've talked to some mental health professionals in vet med about doing this, that we could build on, is they did ask the question of the medical students, do you think that those that had 4 or more ACEs, or they asked everybody actually, and those that had 4 or more ACEs, they said, do you feel like the things that happened to you as a child have negatively affected your mental health today? Mm-hmm. 3 and under, it was like 50%. It was, like 2, like nobody really thought, it affected them. 100% of those with 4 or more said that it negatively affected their mental health. Yeah. And so, which is consistent with what the data shows us. So I just think too, with our support staff, is that they don't necessarily, because of the nature sometimes of the application and all that those protective factors may not be there. Right. And so I'm curious to see, my suspicion is that Dr. Brandt and Dr. Strand were right. I'd be curious to see, and this is what we were actually working with Appalachian State and trying to do this with the NAV, the National North American Veterinary Technician Association, and see if we do the ACEs survey with them, if we do get some of those, if we do see a higher number of ACEs, in them. And why is that important? And I think this will roll into, is how does that affect us at work? Mm-hmm. I was a toxic employee.
Yeah. Say more. Tell us all about it.
So before I knew any, and I mean, I still work. mean, I will always be a work in progress. But I could see where, for me, like negative feedback, any course correction, anything like that was a threat.
Oh yeah.
And it was, and that has, and what I realized, and this was before I knew about the ACEs, I was like, I would say this 10 years ago to my wife. I was like, damn it, I act like, like 10-year-old me sometimes when it comes to that. And I was like, and I was like, that has got to be connected in some way. Like, I'm like, intellectually, I know better.
Yeah.
But it's it's that amygdala, the hijack. And like we were saying, is that that's another nerdy part that, you were talking about, is that our amygdala, the limbic system of our brain is ramped up and is always going to be like that. And that's the thing, is that's already been laid down. So I have to come up with tools to try to throttle that down.
Can I give a little bit of a little more to that?
Yeah,
because for those people listening, let's say you're relating this a little bit. You're thinking, is this me?
Yeah.
Think about, do you ever have that feeling that something triggers you? Like, okay, a person gives you a funny look, or they give you some kind of feedback, or things just don't go the way you wanted them to go. You make a request and somebody says no. Whatever the thing is, it's kind of like a negative experience. And you can feel your body get flooded with adrenaline. You feel like I'm losing control in a way. And some people, their version of losing control is to act out. They might drop the F-bomb or yell or kind of get bigger. And then some people might shut down and just want to avoid it. And they might feel like, I feel really numb. I feel like I can't think straight. I just want to be by myself. I want to isolate. There's this guy, Dan Siegel, PhD, and he does so much work on, the way he puts it is this. He calls it flipping your lid. So he says, you have your frontal cortex up here on your brain in the front of your forehead. That's the part that's like the adult. It's the one it wants to be in the driver's seat. It's like, let's not yell. I mean, yes, that was a disturbing situation, but we're all adults here. Let's think through it and make a plan and be reasonable. And then the little limbic brain that's down more like at the base of your skull near your neck, that's the lizard brain that, you feel we're talking about. That one wants to take over. That's the one that's like fight, flight, freeze, woo. Yeah. And so if we flip our lid, we get triggered. It's like that frontal cortex in the front just flips off and it stops working. And the limbic system takes over. And it's like that animalistic part of us just wants to survive, whether we're going to fight or flee or, freeze and shut down is kind of unique to the person. I think that's what you're describing. So those of us listening 100%. Today, you might relate to one of those. Are you a fighter? Are you a flighter? Run away? Are you a freezer? And just to know that is a mechanism. If you notice that you get triggered easily and you're like, oh, I feel embarrassed about it. I wish that I could stay in control. We're talking about how trauma-informed approaches at work can help identify that and maybe give additional resources that can help us strengthen our frontal cortex and buffer our triggers and be able to work with our triggers better. Coping strategies is what we're talking about. Yeah.
And exactly. And and being self-aware, that's the thing is recognizing that those things are happening and going, and then trying to have that, up here looking down saying, how did you develop curious.
That? 'Cause you were saying that you go back home to your wife and you would say laments like, oh my gosh, the 10-year-old in me is taking over. So tell us more, like, where does it go from there where you're developing your self-awareness? Then what?
Yeah. So that really came from a lot of work in recovery, So in 12-step recovery, you do this thing that's called a fourth step. And so it's an inventory. We call it a moral inventory. And it's not moral. It's just essentially, well, it is, but anyhow, you go through your whole life, one of the things, and you look at all the resentments you have against people. Woo! and so, for me, that was easy. Make a list of all the people, places, and things you have a resentment against. Oh, give me a pen. Give me a pen. I hope you have a lot of paper. I was very angry. I was, as we say, restless, irritable, and discontent. And so wrote down all these things and then go through this process. And then I find out, that's interesting because all of these situations have one common denominator. Yeah. Is me. So, I find out that I played a part in so many of these things. And then realizing the parts of me that triggered that. And this is also the wisdom that's in 12 step recovery. And so let me say this, I'm not pushing it one way or another. It worked for me.
Yeah.
But it was the same. It's that self-analysis. It's that looking at like getting more curious, be curious, not judgmental. That I have that sign up there.
Nice.
That's interesting. Like what part of me is affected? And in that process, we really, in 12-step recovery, talk a lot about fear, fear and ego. And every damn time, like it was like if I was gut level honest with myself, it was always fear. And how did that manifest? Anger. Is that was the way. And so that was how I learned that if I start getting really angry, that it's usually, for me, I mean, there are times where it's reasonable for us to feel angry, but for me, knowing that I overplay that hand, that's now, if I'm like really, if someone, like you said, if somebody says something and I instantly get defensive, it's like, oh, that's there's something's going on with me. Like I gotta, so now it's almost like a knee jerk response to think, oh, that's curious that I'm feeling like that. And do that. But it did take it, it took work definitely to get there.
Yeah. And for people listening too, I think that often when we hear, if we're in kind of the neophyte beginner position of self-exploration and maybe learning about our own trauma, if we have it, and how it may be impacting our work and our life,
right?
We can sometimes feel like, oh, that imposter syndrome too. Like, shouldn't I just be able to be mindful and figure it all out? Shouldn't I be able to fix this? Because as medical professionals, we often love to fix things. It's kind of in our nature, like MacGyver. But I always like to remind people along this journey is that you think about how difficult it was as a child to learn new skills, to learn how to write your alphabet, to learn how to tie your shoes, to brush your teeth. This stuff took lots of repetition. And at first it felt really clunky and really uncomfortable. Such is the journey of like learning self-awareness and learning 100%. New coping skills, catching yourself being a bully and saying, oh, wait, I don't like to talk to myself like a bully, but now what? Because talking to myself nice feels fake. Oh, right. I'm just stuck in limbo land. So I'd like to kind of, as we're coming up on time goes by really fast.
Yeah.
I wonder if we can sort of focus the conversation in a bit. I'm imagining practice managers, technicians, veterinarians and owners are listening to this, and they might be thinking, okay, I'm hip to it. I understand that there are people that are experiencing trauma. I understand that there's an ACE assessment that I can look at and possibly take myself. But what do I do about it? How can I let this conversation inform my next steps, whether I research it more or think about how this might apply to my hospital? What are some things that you want people to take away as they're listening to this today?
Yeah. So let me first say what my direct experience was. And from an HR perspective, I'm not suggesting
HR warning.
HR, right. I'm not suggesting that this be the path that you take. However, how we started really using this in our practice is that, one, I was in surgery one day and I just learned about this, in reading about it. And so I'm actually in surgery talking to our technicians, telling them about this stuff. And two of our techs, and I said, and they were like, well, we want to take it. I was like, okay. And I told them, and I said, if you want to share the score, that's fine. I said, you don't have to tell, what happened, but, if we have this number, and I said, the 4 or more, and 2 of them were 6. And so the 3 of us in the surgery suite had 6 or more ACEs. So I was like, wow, like that just changed how I'm going to give feedback, or I'm going to be more careful, even more careful with feedback, that we can create a psychologically safe. That doesn't mean nice, but we can be direct with one another, but we've created a space where we're psychologically safe, which means that people feel comfortable bringing up ideas. They feel safe, safe being vulnerable and that type of thing. And
Mm.
where it really came to fruition was we were very intentional about creating psychological safety. That term gets knocked around, but that type of environment where the practical application is one of our technicians, if I make a mistake, or if I'm not doing something right, they feel empowered to say, did you mean to do that? Or I just saw that you did this in the orders. Did you mean to do that? Like, and I don't blow my top. I'm like, oh, thank you. Yeah, yes, good. And then we all frame mistakes as an opportunity for growth. So we had that environment. We brought on an awesome new technician, and it was interesting because she had a thing with feedback the way that I did. And I recognized how she was responding. And we went into the office and sat down. And because she felt comfortable with the vulnerability and all this, I told her about the ACEs. And I said, I still struggle with it, but I said that was part of how I realized, where that was coming from. And she took it, and she had 6 too. And our practice manager had 7, our new practice. And it was just, we were like, wow, like here are all of us working together who we just had a fundamentally different appreciation for where we'd all come from. And we were just even closer, with one another. And so I wish we were open enough in the workplace to do that, because I feel like that's kind of the direction we need to go to help heal veterinary medicine. But I know from an HR perspective, it's not likely. Yeah. That being said, trauma-informed leadership, finding different podcasts, finding different webinars, that's where this is. So we talk about trauma-informed workplaces, but trauma-informed leadership is really what I find to be fascinating.
I agree.
Is knowing where,
And I'd also say it can be a little bit of a confusing road when people start trying to learn about this. And if you have people in your network that are, say, psychotherapists or psychologists too, you can reach out to people like us, and we can help. Yeah. We can help with the language of it, like bridging the gap between reading something very clinical and saying, what the heck does this mean? And how does it apply, to just breaking it down into more like layman's terms, and how that may inform just how we engage with our staff and our clients. Because once you start to think about engaging with other people through a trauma-informed lens, it just softens things. It brings more compassion. It slows things down. We start to try and read signals more. And like you said, number one, become curious. So if somebody's having a reaction and we think, oh, I don't like that person's reaction. Why are they being so sassy, or whatever may be going on that feels uncomfortable? To just wonder, like, I wonder what might be going on there.
Bingo.
And starting there is a great starting point. And then building the resources through, having people that you can bring into your hospital that are trauma informed, that can help teach your staff what that means. Doing your own research online. There are so many good resources that we can also link up in the show notes today. Yeah.
And so, and we'll also, one of the things we'll put in there. So I'm on the Workplace Suicide Prevention and Postvention Committee, which talk about imposter syndrome. Like the people that are on that committee are like bananas. I'm just like, okay, I'm here. But we just put together, I say we, like I'm on the committee. I had a chance to read it. That's as much as I did. With some of the leaders in HR and mental health professionals, and they put together a white paper for HR professionals and employment lawyers on how to address mental health in the workplace. So that's it's a little bit what we're talking about here, but I want to put that in there because it's a great resource. Like, what do I do in this situation? But what you just said is, if this person is reacting in a way that I don't like, remember 12.5% of people in the US have 4 or more ACEs. So it's not just the people that we work with, it's our clients. And it's like, can we take a breath and give a little grace, to our clients? Like because we put them in situations where that threat mode is going to kick in. We're going to say things, they're already on edge because their pet's sick, or veterinary medicine, I wish it was free, and it's not. Like there's financial implications to it. And can we help walk somebody through that who may have an over exaggerated stress response? And can we be gentle with them? And it's challenging, but if we know that that's where it's coming from, that it's like potentially one of the reasons why that person is in that spot. And we don't accept aggressive behavior, but like there are things where we can be a little more gentle with one another,
Right.
and give them a little grace. Yeah.
So
Yeah.
well said. Leaving off, like I want to, as we wrap this up in a
Wrap
nice
it up.
little bow. Uh, one thing was, I think we had talked offline about a veterinary support group on Facebook. Was that something that you wanted to
Yeah.
remind people
Yes.
of?
Well, right. So we do have, well, let me say this is that we're starting, we have the vets in recovery group, that's sponsored by the VIN Foundation. You can email Dr. Bree Montana, who is she's just a gem angel of a human being, who kind of works she doesn't head it up, but she's the contact. It's Bree, BREE at vinfoundation.org. You can send her an email, and we have just a great group of veterinarians that we meet every Sunday. And it's genuinely now, it's my favorite recovery meeting.
Aww.
And it's just like we have seasoned vets, we have new vets, we have students. And we're able to talk to one another in a way that, there's still a lot of stigma, around alcohol and substance use disorder. And so, and we're 6 times more likely to end our own life by suicide if we have one of those. So as much as we talk about suicide in the profession, it hurts me that we don't have open and honest conversations about alcohol and substance use disorder, and that it's not a moral failure. And that, again, the gate, as they say now, the gateway drug was not, alcohol or marijuana, it's childhood trauma.
Yeah.
Is that, most, and I would say anecdotally, having had the opportunity to mentor a lot of folks in recovery, that across the board, everyone we've all had the same experiences growing up. Yeah.
It's amazing.
Yep.
We're here today with you showing up and talking about this so beautifully. And I want to highlight the importance of do not do it alone. We heal in relationship with others. We are social beings. That's how our brains are wired. Why do we put people in solitary confinement? To punish them. Being alone, being isolated is extremely painful. It contributes to a lot of mental health challenges. So reaching out and being a part of a group, getting mentorship, just connecting with other people, having a safe place to talk about these things is so important. And for those who might be interested in, recovery or struggling with substance use, not everybody's into 12 steps. If you're hearing that, like I tried 12 steps, I hated it. Just know there are many models.
Many
so please
ways.
reach out and seek out, try different models that might fit for your value system better. And just know there are lots of different ways to get help. And I'd also love for you, Phil, to talk about the type of work you're doing, if people like the offerings that you have in support of this topic today, and how people could find out more information about you.
Yeah, I'm on LinkedIn. I do right now. I'm really grateful I had the opportunity to take on the position, as you said, as Chief Medical and Wellbeing Officer for a group in Michigan. And the CEO, the team, the culture's great, but the CEO, he and I think now are the only vets in the U.S. that are certified in applied positive psychology. So he's fully bought in. So it's like we talked a mile a minute at VMX in 2021, and we were like, we got to do something together, and we got to do that. And then it was, I think, it was like July or something. I was leaving to speak in Philadelphia, and they popped up an ad, like it came up on LinkedIn for Chief Medical Officer. And so I called him, and I was like, hey, what if we like start doing the things that we've really been talking about, and integrate, come up with a program to really integrate well-being, in the day-to-day practice of veterinary medicine. And that's what we're, and what does that really look like? Because I can go and I can speak, but, really creating a model of what that look like in a group of veterinary practices. And so we're going to be starting to do the PERMA workplace survey, and just survey everybody and create interventions. And then, with what I've got and he has, and the team is just amazing. It's anyhow.
It sounds like a match made in heaven.
Yeah. And there's a lot of people, and just there's tons of people in veterinary medicine right now trying to do similar things. And I just love that we're all the tide that's going to lift all ships. So
I love that expression.
Yeah.
Wow.
Yeah.
Well, Phil, I so appreciate the work that you're doing. I love that you are pulling together with other people too, and having like a bigger and bigger impact. I appreciate you being on the podcast today and having the willingness to talk about a more taboo topic. I think it's so important. And we did a great job of giving people a starting point of like with the ACE survey and how to start having these conversations. I really appreciate you being on today.
Thank you, Crystal. I appreciate you.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.